I am in need of therapy. You all are in need of therapy. We all, as a society, can benefit from therapy. Creative arts therapy, that is. I'm sure that everyone knows what it's like to be in a bad mood, to feel frustrated, aggravated, and irritated. Feeling this way can hinder you and cause you to be unmotivated. I also know that you know what it's like to have that bad mood changed into a better one by hearing or seeing something funny, or maybe hearing your favorite song come on the radio or the TV. Sometimes when I've been doing homework for a long period of time and math is my worst subject, I get frustrated and overwhelmed, causing me to have a mental block. But I know if I take a little break, listen to a few of my favorite songs, when I return to my work, I'll be in a different mood and things don't seem so overwhelming anymore. This is because music can be creative arts therapy. According to Psychology Today, creative art therapy is the use of art, music, or dance, movement, poetry, or creative writing within the context of psychotherapy, counseling, rehabilitation, or medicine. Creative arts therapy can help everyone in some way. If creative arts therapy or AT can help with your mental and physical health, I believe it should be covered by health insurance. I'll give you a few examples of how it has helped people in different ways, from helping people with cancer to helping people who suffer from depression, also helping with people with anyone who must be hospitalized for pretty much any reason. In a medical journal called Complementary Therapies in Medicine, H. Boskock and K. Oskin and other authors write how cancer patients at a university hospital were given a choice to participate in painting art therapy sessions to test the effect of AT on quality of life and anxiety. The program consisted of a professional painting artist facilitating and helping the patients to paint while undergoing chemotherapy. The program also gave them supplies to take home and practice. The results showed that AT in the form of painting improves quality of life and anxiety. The results were even more prominent in patients without any previous art therapy experience. AT was recommended in general for cancer patients, not only because it improves the quality of life, but also because of its feasibility. That is just one example of how AT can help better the lives of people. Another example is in a medical journal called The Arts in Psychotherapy. C. Bloomdahl and other authors wrote how AT helped people who suffer from severe depression. They wrote how depression is a common condition and considered to be one of the major current diseases. So participants were recruited to study the effects of AT. The process of making art and describing the experience makes oneself and one's situation more visible, opening up and altering comprehensions through inner dialogue. This process facilitates in the meeting of oneself in an inner dialogue that occurs through the patient's engagement with the image. The meeting of oneself brings about many changes like enhancement of self-awareness, viewing and evaluating current lives in new ways, promoting an increased understanding about one's life, acceptance of one's limitations and strength, and helping to prioritize based on self-knowledge. I think that everyone should meet themselves, even if you suffer from depression or not. The benefits are great. You don't have to be undergoing chemotherapy or suffer from depression to benefit from creative art therapy. If you must be hospitalized for pretty much any reason, creative art therapy can help you. As most of us know, being hospitalized can be a very stressful and anxiety-producing experience. Whether hospitalized for trauma, sudden illness, readmission of a chronic disease, or a planned surgical procedure, a patient can experience a multitude of emotions. These feelings include, but are not limited to, confusion, worry, fear, even anxiety, depression, and stress. In the journal, The Arts in Psychotherapy, T. Scheller wrote about how a study was done at a large teaching hospital to show the impact of creative art therapy. The study was done at bedside, and at the start of the session, the patients were asked to rate their mood, anxiety, and pain. The session averaged about 50 minutes and were facilitated by a team of 5 professional art therapists. The results showed significant improvement in pain, mood, and anxiety levels between the start and the end of the session, with all patients regardless of gender, age, or diagnosis. It was concluded that art therapy may be a safe and cost-effective intervention as a complement to traditional medical management. I've only told you a few examples of how creative art therapy can help people. There are many more. Creative art therapy sessions can be held in a variety of environments, including hospital facilities, nursing homes, clinics, rehabilitation facilities, residential treatment centers, behavioral health centers, and art studios. Studies have shown that AT can make a difference for people with mental health needs, Alzheimer's disease, chronic illness, head injuries, substance abuse problems, physical abilities, and developmental disabilities. The Merriam-Webster online dictionary describes therapy or to be therapeutic as having a beneficial effect on the body or the mind, relating to the treatment of disease or disorder by remedial agents or methods. AT can help people express themselves better, explore their emotions, manage addictions, and improve self-esteem. It is truly therapeutic and should most definitely be covered by health insurance.